The BSW AHP Faculty was first founded in 2021 by Gemma and Gina. The aim of the faculty was to facilitate a collaboration across Baines, Swindon and Wiltshire of all things allied health professional.
What we really had actually was a council. We had a high-level functioning council, and that's what the faculty was. It's the engine room. It's where the workforce transformation really takes place.
Absolutely. I think it's where they learn how important clinical leadership is.
And let's face it, Gina, what was a little bit of an idea in the night about how we might do this, how we might get it done, which turned into suddenly 22 secondments from some of our junior members of staff, some of our most senior members of staff, all coming together.
Workers.
Absolutely.
Giving an opportunity of leadership to our support workers has been an absolute gem part of the faculty.
Claire, Scott and Alex joined as faculty leads later that year and undertook some initial research into AHP workforce supply and demand across the region. This proved so valuable that the faculty soon expanded.
The faculty meant so much to me in terms of forming those relationships to go forwards and work collaboratively, which was improving the workforce transformation and development for allied health professions and support workers across BSW.
In January 2022, funding was secured to recruit 9 lead support workers, 6 workforce development leads and a project manager to join the faculty family.
Being a part of the Faculty Support Worker project was an amazing and inspiring experience. It was lovely to give the support workers a voice, to make friends for life and to see everybody progressing as a result.
Sue and Mary began raising awareness of apprenticeships available to AHPs, discovering the barriers that they might encounter when trying to access and undertake apprenticeships. They even created a video, which has been shared nationally. Gemma looked into international recruitment and created a how-to guide for managers to help them understand the process and how to support the needs of any new international recruits before and after they arrive.
It's been great for talent management. It's been great to help people on their career pathway and show people all of the opportunities that they might not necessarily have known before that AHPs could go on to.
Esther created resources to support AHPs wanting to return to practice, including advice for managers to help them navigate the funding options and support available to promote the awareness of return to practice as a recruitment option.
We were able to feed back barriers and facilitators to the regional next stage of the project in order for them to develop resources and guides that could be shared across systems. There was also the personal outcome for me around experiencing new approaches to leadership and system level working.
Scott and Michelle crunched the ESR data of the AHP workforce so that organisations could better understand the current numbers, bandings, characteristics and turnover of the workforce to enable them to plan for future supply and demand across all professions.
And the fact that we were able to standardise that information means that we are in a much stronger position to benchmark our workforce and also think more strategically about the work we need to do to evolve the workforce.
The 9 lead support workers linked together various healthcare providers, including social care and mental health, to understand what our AHP support workers' hearts really desire and how we can keep them motivated and happy in their roles. This included developing a community of practice, which provided an opportunity to network, creating a video to empower other support workers to have a voice, and they even hit the road to get their message out there.
Raising the profile of AHP support workers is something I'm so passionate about, and this secondment has enabled me to do just that. The roadshows have been a great experience, and I'm grateful having had this experience.
The faculty has really unearthed the importance of a system-wide approach and has highlighted areas, options and opportunities available to help retain, increase and bolster AHPs across BSW, whilst ensuring the workforce feels fulfilled and valued.
And as we come to the close then of our 2-year journey,
Has it really only been 2 years?
the lots of people that we've seen come through our faculty doors have now gone on to get promotions, have gone into other fields of work where they've really been
go and
used.
train.
Absolutely.
The impact that this faculty has generated for the council is going to leave a really strong legacy. I think it's really important that we don't let it disappear altogether, and we won't. It will come back bigger and stronger.